Oculomotor screen, vergence, cover, cover-uncover, and alternating cover test. Neurological explanation of assessment. Vergence test. Vergence. The simultaneous movement of both eyes in opposite directions to obtain or maintain single binocular vision. Cranial nerves 3, 4, and 6 innervate all of the muscles responsible for moving the eye, as well as control the pupillary constrictor muscle. Accommodation to convergence is impaired in lesions of the ipsilateral optic nerve, the ipsilateral parasympathetics traveling in cranial nerve 3, or the pupillary constrictor muscle, or in the bilateral lesions of the pathways from the optic tracts to the visual cortex. Vergence movements maintain binocular fusion. The two principal stimuli are retinal blur and disparity in the location of the images on the two retinas. The two eyes diverge when an object is moving away and converge when it is approaching. Experimental evidence indicates there are neurons in the visual cortex that discharge maximally when targets are located correctly in the visual fields of each eye. Experimental evidence indicates neurons in the oculomotor nucleus and in the mesencephalic reticular formation are involved in vergence movements. Vergence dysfunction involves disjunctive eye movements in which the visual axes move toward each other, convergence, or away from each other, divergence, resulting in the inability of the eyes to accurately fixate and stabilize the retinal image. Cover test, cover-uncover test, alternating cover test. The aim of these examinations is to assess for ocular alignment, observing for potential strabismus, tropia, and phoria. Strabismus is an anomaly of the ocular alignment that can occur in any direction. It is characterized by a misalignment of one or both eyes that may run inward, nasally, ezo, outward, temporally, exo, upward, hyper, downward, hypo. A latent strabismus is present only when fixation is interrupted, while a manifest strabismus is present without interruption of the visual axes. The terms phoria and tropia are used to describe the latent and manifest strabismus respectively. In other terms, tropia is a misalignment of the two eyes when a patient is looking with binocular vision, and the two eyes are looking at the same object. Phoria is a misalignment of the two eyes that only appears when binocular viewing is broken and the two eyes are no longer looking at the same object. Indications and contraindications. Indications. An individual suspected of sensory or neuromuscular disorders. Also, an individual presenting with the following symptoms: strabismus, diplopia, eye strain, blurred vision, headaches, loss of place while reading, needing to reread, eye fatigue, or general fatigue. Contraindications. There are none. Test psychometrics. After a thorough review of the literature, there is currently no existing literature supporting the psychometric properties of these examinations. One limitation of the cover-uncover test is that small deviations up to 2 to 3 degrees cannot be observed by experienced practitioners. Step-by-step detail, vergence testing, performance, and outcomes. First, position the patient comfortably. Next, the therapist asks the patient to focus both eyes on their finger, positioned at a distance of approximately 2 feet. The therapist then slowly moves their finger towards the patient's nose and observes for convergence, symmetrical bilateral ocular adduction, and pupillary constriction. The point of maximum convergence is the point at which one or both eyes lose fixation and deviate outward. The location of this point is usually 8 to 10 centimeters, but it increases with age. Positive test. Vergence is impaired if one or both eyes are asymmetrical during convergence and/or the pupils do not constrict. Negative result. Observe symmetrical convergence and pupillary constriction. Step-by-step detail on cover test, performance and outcomes. First, the patient fixates on a pointer object. Next, the therapist covers one of the patient's eyes. The therapist then observes for movement of the uncovered eye. Last, the therapist covers the other eye and repeats the test. Testing occurs with both a near object and a far object. Repeat each test 3 times for reproducibility. Positive results. The uncovered eye moves to refixate on the target. Negative results. No movement is observed in the uncovered eye. Step-by-step detail on cover test, performance and outcomes. First, the patient fixates on a pointer object nearby. The therapist then covers one of the patient's eyes for 1 to 2 seconds. The therapist rapidly uncovers the eye. The therapist observes for movement of the previously covered eye from a deviated position back to fixation on the pointer object. Next, cover the patient's other eye and repeat the test. Test with both a near object and a far object. Repeat each test 3 times for reproducibility. Positive results. The previously covered eye shifts back into position to refixate as it is deviated while covered. Negative results. No ocular refixations are observed. Step-by-step detail on alternating cover test, performance and outcomes. First, the patient fixates on a pointer object nearby. Next, the therapist covers one of the patient's eyes for 1 to 2 seconds. The therapist then rapidly uncovers the first eye and covers the second eye for 1 to 2 seconds. Next, the therapist rapidly uncovers the second eye and covers the first again for 1 to 2 seconds. The therapist observes for refixation. Test with both a near object and a far object. Repeat each test 3 times for reproducibility. Positive results. The previously covered eye shifts back into position to refixate as it is deviated while covered. Negative results. No ocular refixations are observed. Uncover results. If the right eye moves when the left eye is covered, the diagnosis is right eye tropia. If the left eye moves when the right eye is covered, the diagnosis is left eye tropia. If the right eye moves when the left eye is covered, and the left eye moves when the right eye is covered, the diagnosis is alternating tropia. If neither eye moves when the fellow eye is covered, the diagnosis is no tropia is present. Now check for phoria. Alternating cover-uncover results. If the eye moves in when the cover is switched to the fellow eye, the diagnosis is exophoria. If the eyes move out when cover eye is switched to the fellow eye, the diagnosis is esophoria. If no movement is seen when the cover is switched, but the patient reports a shift in apparent target position, the diagnosis is phoria present with in exophoria, against in esophoria. If no movement is seen when the cover is switched, the patient reports no shift in target position, then the diagnosis is orthophoria.
Hello, how you doing?
Good, how are you?
Good. So you've been telling me you've been having some neck pain and headaches?
Yes.
So what I'm going to actually do is to start our exam today is actually look at how your eyes are moving and how they're coordinating with each other. Because what happens is actually sometimes if your eyes aren't working well, that can cause your headaches by, you're not able to focus on things quite well, so you've always kind of got that hard headache. Putting on glasses, you're not able to focus, sometimes causes a headache. So what we're going to do is we're going to see how your eyes are coordinating and moving together, as well as their ability to focus together, each eye, and then their ability to focus individually.
Okay.
So what we're going to do is some quick tests real quick. The first one is called a Burgess test. So what I'm going to have you do is focus on my finger. So what I'm going to do is I'm going to bring my finger towards your nose, and I want to see how your eyes move in together and move out together. And then also, as you're doing that, I'm looking for any constriction of your pupils to kind of look at that. And your eyes moved in together and out together very well as your pupils constricted well. So that's a negative test. The next one I'm going to be doing is looking at your eyes to switch focus and focus together. It's called a cover-uncover test. So what I'm going to have you do is focus on my nose, and I'm going to cover up your left eye, looking at your right eye to see if there's any movement in that. And have you continue staring at my nose. Good, there's no movement or deviation of your right eye as I was covering your left eye. So now I'm going to cover your right eye and look at your left eye to see if there's any deviation there. Good, there's none of that. Now what I'm going to have you do is look at the clock behind me. Do the same thing, so any distant object is good. Just continue to focus on that. Again, cover that left eye, look at that right eye. Cover the left eye, look for any deviation to the right. And then the same thing. Okay, great. Your cover-uncover test was negative, so now I'm going to do another test looking at your eye's ability to switch focus from one eye to another eye, as well as see if there's any deviation in those as well. This is called the alternating cover test. So what I'm going to have you do is stare at my nose again, and I'm going to cover one eye and then quickly switch either eye, looking at any deviation of those eyes as I switch back and forth. All right, great. Now again, I'm going to have you stare at the clock behind me and do the same thing. All right, great. I didn't see any deviations with those, so that's good. So what we did today was we kind of looked at kind of how your eyes are able to coordinate with each other, as well as your ability to switch focus, and then also focus each of those individual eyes and focus them together. You had negative results for all of those, so that means I didn't see any deviations of your eyes while we did any of those tests. So do you have any questions for me?
No, I think I'm good.
Okay,
Thank
great.
you.